Welcome to Deuk Spine Institute. Our patient is here from Colorado with facet joint pain. You can see on the x-rays she has had an artificial disc which then failed and started to pop out of her spine. We had to do a fusion on her. That was over a year ago. She's done well with that. However, she's developed adjacent segment disease. She now has facet pain above and below her fusion. Shot? I'm going to start by performing a rhizotomy here at this level. Shot. Show us exactly where the pain nerve is there, Jordan. That's right. The pain nerve runs right there. That pain nerve has a name, folks. It's called the medial branch of the dorsal ramus. Medial branch of the dorsal ramus. And if I can successfully destroy it, that will get rid of her facet joint pain. Show us on the video how that works, Henry.
Of course.
For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922. Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
Sean. All right, welcome back. We are just finishing up our rhizotomy here, Deuk plasma rhizotomy. Sean. And our patient, just to remind you, as you see on the x-ray, has had prior back surgery at L3-L5 with an artificial disc that failed. It popped out. We did not put that in. I don't recommend artificial discs ever because they do pop out. And it was done elsewhere, but she came to me for help afterwards to rectify the situation, and we did. We had to do a salvage fusion at the time. She did very well, Sean. Now she's developing adjacent segment disease as a result of that artificial disc and fusion. Adjacent segment disease is where patients start getting pain from joints above and below their fusion or artificial disc. Turns out that the rate of adjacent segment disease is the same for artificial discs and fusion. Sean, we're just about done. Any questions?
Yes, we have a question coming from Lanu on YouTube.
Yes.
Asking, do you see any signs of arthritis on this patient?
Oh yeah. There's arthritis for sure. Show the facet at L5-S1. It's not horrific, but right there, you can see a little bit to the left there. There's some bone spur even further to the left right there. Yeah, there's arthritis. The SI joint also. But more importantly than quote-unquote signs of arthritis is the fact that the patient has pain. Sean? And the only thing that causes pain in this area is the structures we're treating, these joints. All right, that's it. We're done. Any other questions? I think there might be one more, right?
Yes, coming from Stuart on Facebook,
All right, Stuart, we'll take it.
asking, I was under the understanding that disc cannot heal. In other words, if it's already herniated, there's no way for that disc to in essence, heal itself. Am I wrong on this? I know that chondroitin sulfate and other things can help your discs, but just curious about that, Doc.
Yeah, so Stuart, you are 100% correct. Once you get a tear in the back wall and the jelly from inside the wall starts pushing into that tear and holds it open and creates inflammation, it will never, ever heal on its own, ever. But I developed the very first surgery in the world to help the disc naturally heal. But you have to remove from the disc wall, you have to remove that herniation that's stuck in there, because once you take the herniation out of the wall, then you get rid of the back pain, but you also allow the disc to start healing back to normal. So that's what our procedure we just did, the Deuk laser disc repair. That procedure is the only surgery in the world that allows the disc to repair itself and heal itself. Thanks for joining us. We're done. We're going to be back shortly. We have 6 surgeries today. 2 of them are going to go into room 2, which doesn't have broadcasting equipment. The other 4 we'll do here, but we'll be back shortly in about 30 minutes with our next surgery.